So mihi nui kia koutou, ko tai mai I roto I te kaupapa o tēnei wānanga, tēnā koutou. Ko Sue Crengle tōku ingoa, ko ahau he uru o kaitahu kati māmue me Waitaha. He takutaha hau, he kairanga hau I tēnei, mō tēnei kaupapa. Ahau, nō reira, tēnā koutou, tēnā tātou katoa. Hello, everyone. Welcome to this seminar on some quantitative and some qualitative findings of our research program around older drivers, and in particular for this seminar on the experiences of older Māori drivers. My name's Sue Crengle. I'm a GP, public health physician and Professor of Hauora Māori, and I have been involved with NZPATHs, not since its very first round of data collection, but for a number of years now. And I'm very delighted to present to you our baseline findings for Māori Kaumātua drivers. And joining me today is Kim Arrowsmith, who has led the qualitative component of this work and will present the qualitative findings. I really want to acknowledge the Transport Network for hosting this seminar, and also Rebecca McLean, who is the principal investigator for the NZPATHs study. So welcome, and I'll just bring up my PowerPoint presentation and we'll kick off. Kim's going to introduce herself when she starts her presentation. Where am I? To share. Here we go. So can you just give me the thumbs up if that looks all right, Kim? Great, thank you. Really just, let me move things. This slide illustrates NZPATHs, which is a longitudinal study of older drivers, and Haumaru Panuku Oranga, which is the qualitative component of this research. And we're funded by the Health Research Council of New Zealand. So Mason Jury in 1999 was writing about Kaumātua and sort of said, unless their position is adequately considered in advance, there is a danger that they, Kaumātua, will become a seriously disadvantaged and alienated group. And really the contribution that this makes, we're hoping that this research contributes to reducing some of the disadvantages that Kaumātua face. So the aim of this project was to describe Kaumātua transport practices and planning for driving cessation. And so NZPATHs is a longitudinal study. It has 1,008 non-Māori elders and 173 Māori elders. Was with recruitment, we made efforts to ensure that we recruited a slightly higher proportion of Māori, so that we would have reasonable numbers, but even so, we can do some baseline, share some data about baseline information, but it will be very difficult with this number to do more complex, multivariable and longitudinal analyses. So these are the demographics comparing Māori and non-Māori. The column on the left for each group is the number, and then on the right is the percentage. And you can see there's slightly more younger participants in the Māori group than the non-Māori group. Representation of this is access to, it's from the New Zealand Index of multiple deprivation, and it's slightly different from the NZDEP index. And this is using one component of the IMD, which is around proximity to services. And you can see that really similar proportions of Māori and non-Māori have in each of the quintiles for proximity to services, slightly more Māori living in places that are further away from services. Self-rated health was slightly fewer Māori reported excellent or very good self-rated health, and slightly more reported fair or good health. None of these differences were statistically significant. A higher proportion of Māori reported that they remain, so these are all people over 65, and a higher proportion of Māori reported that they remained in full-time employment that was working 30 or more hours per week, and a lower proportion reported that they were retired. And you'll see that compared to this graph and the previous one and the following graphs, I've only included the percent just in the, for trying to make the graphs a little bit easier to see online. This is the regional distribution of participants, with slightly fewer of Māori in the South Island, whereas higher proportions in Gisborne, Hawke's Bay, Northland, where there is a greater proportion of the Māori population. This is repeating the previous slide. So here's some information about transport mode, and the asterisk lines, the differences are statistically significant. So you can see that for both ethnic groups, the most common transport mode was driving by yourself alone. And that was followed by, I think that should be driving with passengers, so 90% thereabouts for both groups. And traveling as a passenger, again, was equally common. Fewer Māori walked for transport, and that was statistically significant. And fewer Māori used a public bus or a tram or a train. And we might anticipate that at least one of the explanations of that was that a greater proportion of the Māori population live in more rural areas where walking as a form of transport or public transport may be more challenging. Similar use of transport to do errands, which was very ubiquitous. Almost everyone used their usual transport mode to do errands. More Māori use their transport to get to work, and that kind of is consistent with a higher proportion being in paid employment still. Similar proportions use transport to get to health services or other community services. Higher proportion of Māori used it to go to church and spiritual activities, and nearly everyone used transport to visit family and friends. Driving destinations. So we asked people about driving in their own neighbourhood, a little bit further than their own neighbourhood, neighbouring towns, and then more distant regions. And you can see that driving in your own neighbourhood or close to your own neighbourhood was very common for both ethnic groups. To neighbouring towns, slightly more common for Māori. And again, this may reflect higher rural population for Māori. And then even more distant towns and other regions, and again, more distant, are slightly higher for Māori. In terms of, we asked people about their planning for the cessation of driving. slightly higher proportion of Māori said that they had discussed this with a family friend or doctor, 35% versus 29%. And then we also asked people about how much they thought about stopping driving. And the majority of people in both ethnic groups didn't think of it at all, or only thought about it a little bit. Kind of similar proportions, but similar but smaller proportions, thought about it somewhat or a lot. And the differences between Māori and non-Māori for this variable are not statistically significant. A smaller percentage, 4% of Māori, had actually made plans for not driving versus 11% of non-Māori. So in our conclusions and implications for Māori, as for non-Māori, there's a very heavy reliance on the private car and very little planning for cessation. And that we think it's really important that transport infrastructure is in place to support healthy aging, especially for Māori who live in more rural areas, smaller towns, and even more rural areas than that, where there's the potential for social isolation when there's no, when they're not able to drive and there's no public infrastructure for them. Of course, Kaumātua, there are lots of, as Kim, I think, will talk about, there are, lots of community and whānau opportunities for support for driving. But where these are not available, then having good public infrastructure would be helpful as well. And this is just acknowledging our advisory groups. And also our research staff and interviewers have been involved in the work. We've done multiple waves of quantitative data collection, as well as the work that Kim and her team have done with the qualitative work. And we've had a number of awards from the Health Research Council and from a university postdoctoral fellowship to support the work. Nō reira, tēnā koutou, tēnā tata katoa. I think over to you, Kim, and then we can ask people if they've got questions at the end.
Okay, thank you. I'll just see if I can get this to work. And then, okay, can everyone see that? Hopefully, yes. Sue, can you see that?
Yes, yeah.
Okay. So, kia ora koutou katoa. Nā mihi mahana kia koutou, ko Kim toki ingoa no tamiki makaurau aho. My name is Kim Arrowsmith. I am an Assistant Research Fellow with NHC, National Hauora Coalition. I also have a background as a nurse and as a designer. And I'm currently working on my PhD with University of Auckland. Today I'm presenting on one of my favourite projects, which is focused on kaumātua and transport. As we all know, our elders play an important role in our families and communities. Amongst many gifts they give, they uphold our traditions, they pass their knowledge where they can to ensure its survival for future generations. Kaumātua access to transport is important because it's intrinsically linked to positive health outcomes. Older adults who can easily use transport are more likely to engage with healthcare services, connect with family, community, and participate in society, all of which contribute to an improved quality of life. As such, access to transport is a known well-being indicator for older adults aging well. As we know, many of our kaumātua have faced significant adversity that stems from a history of colonisation. This has had an ongoing effect to many indicators of well-being. Without adequate access to transport, we know that our kaumātua risk social isolation, which is strongly linked to negative health outcomes, and poorer cardiovascular as well as mental health outcomes. We believe that ensuring that this population group can easily and confidently navigate transport systems in Aotearoa is essential. Haumaru Panuku Oranga, which roughly translates to safety and health in the next life, was created to gain insights into the world of kaumātua and transport. We worked in collaboration with the University of Otago and their NZPATHS project to research kaumātua perspectives of transport. Data was collected from across the motu. We recruited through NHC networks from Northland to Otago and had 50 participants in the study. We interviewed people from rural and urban areas so we could compare those experiences. This project was Māori-led throughout the whole research process and used kaupapa Māori methodology alongside qualitative methods. Our data was collected through our networks to build trust with our participants. We utilised a Māori advisory group who we consulted with throughout the process, and their input made a significant difference to things like data collection. So we had a huge variety of transport options reported. So they included tractors, horses, private vehicles, as Sue said, kaumātua vans provided by the marae, and hikoi. With wānanga and one-on-ones and go-alongs, the data collected was varied. Our participants were very open with us about their experiences, and of note, much of the content was around social injustices. These photos here are examples of the go-alongs in Tairāwhiti. The go-alongs, which were a suggestion from the advisory group, were where a researcher travelled with a participant on a journey they would normally take, like to the shops. So what I've written here on the slide is from some of the notes from collected from the researcher. So she says, regarding the road just outside the participant's house, researcher says, would you go for walks around here? The participant says, I don't. And then she also says that the participant reported that the roads are too bad to walk on and sometimes drive on. So moving on now to the themes from our analysis. In our data, we found that there were significant barriers to transport. Kaumātua feel forgotten, isolated, and are struggling to be part of their own society due to travel constraints. Whānau willingly supply most transport needed for their own kaumātua, but they were also underserved by the transport system, especially rurally. However, in spite of this, Mana Motuhake, or resistance, became the overarching theme of the study's findings. Mana Motuhake meant to resist or push aside the very idea of kaumātua remaining inactive, isolated, or neglected. Mana Motuhake also encompassed the way that kaumātua and whānau found ways to achieve travel needs, but they resisted the idea that it was right to countenance these barriers. Here is an example of where participants described resistance. You'll see here that they use the word resilient. One of the first part of the analysis was reinterpreting resilience as resistance. This was in line with current Indigenous academic thought, where there is opposition to the use of the word resilient. Resilience implies that Māori should adapt and accept their transport conditions without acknowledging the impact of systemic discrimination. So a participant says here, we're resilient up here, but we shouldn't have to be. We've got rights like everybody else, and we should have the same. We don't. There were also sub-themes of resistance. Kaumātua and whānau resisted systemic barriers to transport access. While the participants did not specifically say systemic barriers, participants discussed and referenced resistance to two commonly systemically derived barriers, prejudice and socioeconomic circumstance. Mana Motuhake was seen in the way kaumātua identified the systemic barrier, described it as unjust, and then discussed how they managed it. So, two quotes here. A lot of them are still working, and it's just the way it is. That retiring at 65, it doesn't even happen here. They've just got to keep going and going. You need to. And then the next quote, yes, you've got to choose food or pay your power. Register your truck or your vehicle. You've got to choose. Kaumātua and whānau resisted also the Western and colonial concept of individuality embedded into transport access. This concept was divided into a resistance to the idea of individuality, and more specifically self-reliance, and a resistance to social isolation caused by ideas of individuality. The benefits of social health to Kaumātua through communal transport was evident. So a participant says here, it's a no-brainer if they need to be. I've travelled out of Auckland to go a 5-hour trip somewhere just to take them somewhere. I think Kaumātua and Kuia especially, it's important that they get the necessary support they need, whether it be for health or anything, because they hold a lot of knowledge too, and we need to try and look after them so we can get that knowledge later on. As you can see here, it was important to Kaumātua and their whānau that they receive the necessary support, particularly for sensitive appointments and to spend time together sharing knowledge. Collective transport supports that. Local Māori council, iwi, whānau and ministry health workers who lived in the community resisted the concept that Kaumātua should have to take responsibility for their own transport. While many Kaumātua were proud of the fact that they could still drive, they took a broader view. When they took a broader view, it was communicated that Kaumātua shouldn't have to drive themselves. As such, many participants across all regions were supported by whānau or iwi for transport. A Kaumātua bus/van was reported many times in different regions, Tairāwhiti, Waikato, Kirikiri, Tamaki and Northland, as a service provided by the local marae. The Kaumātua vans were designed for people with disabilities and would patiently pick up Kaumātua from their homes and take them to activities at the marae. So from our findings, we have 6 recommendations. So number 1, future transport decisions at the policy and strategic level need to be whānau focused. Kaumātua and whānau overwhelmingly preferred whānau to transport Kaumātua. How whānau can be supported to transport their Kaumātua needs to be considered when producing transport policy. The second recommendation was increased cultural considerations around transport policy creation. For government transport policy to support Māori communities as they do Pākehā communities, future policymakers would need to assess biases from the outset of policy creation to intervene appropriately. Number 3, the participants highlighted the need to reduce the cost of transport for Kaumātua. Transport in Aotearoa is expensive and in many cases exceeds Kaumātua means. Consideration should be given to policies that reduce inequity and burden, including adjusting the eligibility age for the Super Gold concession card to reflect Māori, that Māori are considered Kaumātua from 55 years. Number 4, more funding needs to be allocated to rural living Kaumātua. Kaumātua, as Sue said, are disproportionately affected by urban-focused transport policies because many Māori communities are rural. Overall, poor transport and insufficient options were reported by the rural community. The preferred option outside of whānau were Kaumātua vans provided by the local iwi, and this was largely funded by iwi. Number 5, to avoid furthering inequities and the digital divide, a review is required on how older and particularly Kaumātua Māori engage with the user interface of public transport applications. Existing platforms are viewed as overly complex and pose barriers to use. Once a review is completed, then specific programs that support Kaumātua and whānau to use platforms are needed to be developed. And then the last recommendation is to improve transport support for Kaumātua and Aotearoa. Further kaupapa Māori research needs to be completed. This is especially per region, and there is a socio-economic disparity between urban and rural living Māori communities not acknowledged by current transport policy. Researchers found that there was very likely that there was minimal research just generally regarding Kaumātua, and this is very likely to impact the resourcing currently available to this community. So that is our presentation. These are all the researchers that were involved. So that's Sue, Rebecca, Rachel Brown, who is not here today, and then there's Shannon Alua, Tera, Phillips Sinpuna, Monley Ikua, who are, I think, watching. And yeah, that's me.